can go, this is just a starting point. He stressed that. So I think we always, I think, are really good at combining our thoughts and stuff like that. So an update of how your clinical site is going so far. Anything of note you would like to share? Anything that first pops out to you guys?
8 years in the college setting. I'm in the secondary school setting in a small bubble of a town, and they call it the bubble. I didn't say that. They call it the bubble themselves. And so that has raised some big challenges for me, but I had a big win this past week. So I had an emergency situation with a head injury at my football game on Friday. Like Friday the 13th hit me hard, guys. And I knew where to send him, who to call to let them know that we were coming, who to refer him to, like got him into the specialist after he was discharged. He went to the specialist this morning first thing. So after a month in, I finally feel like I'm learning to navigate the clinic and connections and all that kind of stuff. So it's been a struggle, I guess, but I had a big win. So now I'm like, okay, I got this.
Mm-hmm. That is so great. Anyone else?
I think for me, so I work in an orthopedic urgent care, and I don't actually do any evaluation, diagnosis, or anything. I don't do any like the only thing I really do is either room patients and take a history, or I discharge them, which include like possibly doing like equipment or like brace fitting or things like that. So it's actually really hard for me to work in this setting because I feel so like underutilized, because I'm like, I could be diagnosing people when we're slow, like just let me do it. But I've learned like a really good amount of like clinic skills that I don't think I would have ever gotten. Like I never would have known what x-rays to order if someone comes into a clinic, or like how to interpret MRI result readings or things like that. Like I've learned a lot, and so I think for me it's very challenging because I want to be doing so many hands-on things, but I am finally kind of like learning to appreciate and like get what I can out of it, and really like now I'm doing some outreach stuff too, so I'm really trying to keep up to date with what I am like actually doing, like game coverage as well as working in the clinic. So I'm really kind of like keeping up with that. And like the other day I covered some hockey, and Olivia, similar to you, I had a win where like a girl, I haven't done an evaluation for like 4 months, and so this girl like one of my patients went into the boards with her arm like outstretched. Long story short, she dislocated her elbow, and it was, I like felt really confident. I was like you said, like I knew what to do, I knew where to go, I knew what to do for my evaluation, what vitals I needed to check, and if it was safe to send her and everything. And so it was really nice to be on the sideline again and actually get to like put to use my skills and everything. And I'm really starting to click with one of the doctors too. Like he specifically requested to work with me because he said, and I quote, that I was wicked smart. So that was good, even in the midst of how difficult it is to work at the clinic.
Yeah. That's awesome.
Nice. Good for you. Congrats.
Thank you. You too. You too.
Mine is like kind of, little changes, little gains here and there. I've worked at the same setting for 7 years now, and I feel my win is that I'm really excited that I can talk to my coaches in terms of where I want to see things grow, and that I'm getting their, I guess, buy-in to some things that I've been trying to get their buy-in on. I see that I'm speaking with more confidence with them. I feel not connected, but I feel I'm understanding who I am, and this whole like the whole why book. I'm so bought into the why. I'm like, I now understand like why I'm here and where I want to be and where I want to go. Instead, before I was like advocating for myself with like kind of loose roots, and I can see that. And I'm also I know that the objective is talking about patient-centered care. Another win that I'm excited to see, a habit that I've gotten into, is talking about things that the patients want. I'm still really trying to coach myself to make sure I'm making goals with almost all of them, which is really hard to like sit down and make goals with them. They're so used to, and this is probably just me, maybe. I'm so used to they're telling them what they need to do that I think they're uncomfortable. And I'm like, so when do you want to return? Or what, what date are we moving by? And they're like, I don't know. Well, what do you want? And I'm like, it's not about me. It's about you. So it's a little, I'm getting better with how uncomfortable that conversation is. But, I'm excited to see that I'm doing things like, what do you value most? I can't believe how many things I used to overlook with patients simply because I didn't ask, what they really wanted. I had one patient, this one's almost kind of like, it irritates my soul a little bit. I've been working with one patient for about 2 years on the same chronic problem that I could never figure out what the deal was. I refer him and then he never gets in or something happens. So it's basically just me trying to operate with this kid. And he finally came down and he's like, you know what? I don't actually enjoy football. And I'm like, ah! So, and it was only because I finally sat down and asked and said, when are you thinking about returning? He's like, actually, I don't think I want to do this anymore. So, you learn, but I was just excited to see that I am implementing that and I am taking the good with the bad, the things that irritate me, and still supporting what the patient wants, because it's not about me, I guess.
Mm-hmm. That's awesome.
I like that. And I think to piggyback off of that, especially in the military setting, it's always like I have to be ready to go. I have to be ready to be deployed. And I'm like, you're a father, you're a brother, you're all these other things. So like I like put your sailor aside for a second, and what do you want? And they kind of like look at me like, I don't know. And I'm like, well, think about it. Like, think about it by the next time that I see you, and kind of think about what your goals are, because, I think that's really important. Like, I value you as a person and not as like just trying to make sure that you're deployable maybe when you're not ready.
Yeah.
The other thing too is like, I've never been one to really talk about like mental health. And I've been really like, I've been talking about that, and responses from it that I don't think I would have ever asked for, like, or really asked prior I'd like actually done. So like I had a patient, and he was he was on leave, and he was in a drive-by, and he got shot in his hip. So I wasn't seeing him for that. But then subsequently he fell on the stairs and he tore his ACL. So he's got like 2 things going on, and I'm like, how are you doing? And he just like broke down to me, and I was like, have you talked to anyone? First of all, I don't even know really what happened with the whole situation with your hip, but like I know that you were shot, and I don't know how, but that's got to be really intense. Like, like, are you doing anything about that? And he was like, no. And I'm like, so I went and I talked to my supervisor. I was like, hey, can we put in a referral for mental health? Because I feel like he really needs to like talk about it. And then the next time he came back and he thanked me, and he's like, hey, thank you for like listening to me. Like, usually in the military, like mental health is so negative. You're like, you're supposed to be strong. You're no feelings. And like, I'm like, yeah, absolutely, man. Like, you're not just a sailor. You're other things too.
That's super cool.
Mm-hmm.
Yeah, to go along with that, I actually had a patient today that she was like so worried and stressed about school and volleyball and everything that she's so nauseous that she hasn't eaten for like a week. And she's only eaten like saltine crackers and stuff, and she keeps puking, and she was just like freaking out. And so I got her into the athletic training clinic and like talked to her, and she calmed down for me. And then she also had an issue with her hip, and it turned out just to be like a hip pointer. And then her coach came in and started like chewing me out in front of her because I couldn't help her with her bruises. And so then that made her get all worked up again, and he started like chewing her out for like a bunch of stuff. And then he like left, so I had to calm her back down. So I felt like it was a win just to like be able to calm her down like twice.
Yeah.
Yeah, it was pretty rough.
Well, and that she felt safe enough to like stay in that situation. I don't get, like, I've never had a situation like that, but the amount of stress that our football coaches, like, I hate that my facility is like, so it's the coach's office and then they kind of come around a wall and they pass by as they're exiting my facility. So they're like, they peek in the window, they're like, hey, what are you doing here? And I'm like, no, like, it's okay to be here. Like, please don't avoid me. And all these things, they don't realize the amount of stress that puts on a patient when it could be a low stress thing. They literally could be there for a Band-Aid, but because they're getting interrogated about it, they're like, oh, whatever, can't get a Band-Aid without getting judged. And I think that's definitely a win, that the patient felt safe enough to stay with you and found solace being in your clinic. I commend you.
Well, and
Vinny,
what you said too, Jody, like you saying to the coach, no, it's okay, that has power too for yourself and the coach in that dynamic, but also you and the patient, because now the patient sees you sticking up for them, and especially with secondary school students, that's huge to have an adult that's advocating for them like that. Because I'm in a very similar situation, and I did it at the collegiate setting too, because the coaches would come downstairs into our facility and they would walk through to see like who was in there, which we tried to mitigate as much as we could, but it happened there too. And I would say they would start to interrogate, and I would handle it differently depending on the situation. But a couple of times I've just looked at coaches and like, we're not going to have this conversation here right now, and the coach leaves and the kid will say, oh, thank you so much. So there's a lot of value to that too. And good for you, for Sydney, for being that person. So
I appreciate that very much, because you're right. I didn't realize how much value there was until I finally, that was one of those things, like I feel more confident in myself to say like, this doesn't really concern you at this present time. And they are looking for that advocate. The patients are looking for that advocate.
So I had a win. So in my area, we have a lot of retirees, and a lot of people they come up here for the summer and then they go back to like Florida or Arizona for the winter. And so they're starting to make that transition. And so I've started I have to find you a provider in Arizona again. and I have 3 of them, and all 3 have had very similar reactions. Like, we're not going to find somebody like you out where we are. And I'm like, oh, thanks. So that always feels good.
Yeah.
Definitely.
Good warm fuzzies.
Yeah.
So we've talked about some successes, and then some of us have talked about struggles. Does anyone want to add any struggles? I guess we haven't really highlighted struggles.
Actually, Sydney, I want to go back to how have you approached that coach since that incident?
So that was today. Like, it was
fresh.
But yeah, so the encounter that we did have, it was really frustrating because he asked how he could help the patient, and I said to like maybe like, so I work at St. Mary's. Well, I'm like with the St. Mary's volleyball team here, and all the coaches seem to think it's okay to have like 3-hour practices. And this particular coach has pre-practice before practice. So half the girls will practice for an hour before the 2-hour practice, and they alternate every day. So I told him that maybe like not putting, because this player, she even admitted today, she was like, I will die before I let the ball touch the ground, because they're playing volleyball. And so I was like, that's her mindset, and you can't talk her out of it. So maybe like not putting her in that situation so much, or not like having her intensity. And he's like, well, she shouldn't be diving on the ground anyways, because that's not what volleyball players do. And so I feel like what we're going to have to do is like, and I told the athlete, like, if she feels like she needs to come back to me like during practice, that's okay. Like, and just, we can go into the athletic training clinic or go on a walk or something like during practice, instead of her being in that situation where she feels like she needs to dive, because she's like a junior, like she's probably never going to get that out of her head to not dive, it's just like second nature. So I feel like that's how it's going to have to be, is like she's just going to have to come to me and we're going to have to like remove her from the situation.
Do you have plans to, I know it's super fresh. Are you thinking about approaching the coach, or are you just going to handle it from the patient's point of view?
I think we're going to have to, so Shannon Hamilton works there with me, and she's the one who did yoga at DAT.
Oh, okay.
Yeah. And so we did talk about like all the team is kind of stressed. So we did talk about like we did yoga with the soccer team last Friday. So maybe doing something like that, like trying to integrate that into the practice. But the coach is he's kind of hard to deal with, honestly. Like everything that we suggest, he's just like, okay, and then just does his own thing. So it's difficult.
Yeah, that you have to assert yourself to get any grounds. That's frustrating.
Would you say that Shannon is your mentor at St. Mary's?
Yeah, I would say so. Because I definitely like every day we like debrief afterwards and talk about what went well, what didn't. And it's just nice because she already went through the program, so like I can ask her a lot of questions about that and everything. So it's super nice. But also I'm technically a float, and so that's another challenge that I face, is that like I'm with the volleyball team most of the time, but then I'll like go and cover like a random high school football game or a random cross country meet. So that's kind of difficult for me because like I don't know any of the patients. So, but yeah, I mostly, even if I have issues at like the football game, I just go back to Shannon and be like, hey, this is what happened. So I would consider her a mentor.
How else, I'm curious how the rest of you guys, how are you utilizing your supervisor as a mentor? Or are you, or is that some focus for anybody? So like I have a strange situation. We do not have a like hired or volunteer physician that comes and is really a part of our facility. I have relationships with, various physicians for, whatever reason, whatever their specialty is, that, they really help me out with my patients. If there's someone that needs to get in quickly or whatever, they help me out with those things. But no one that I have ever utilized as a mentor or anyone that I've ever checked in with. If there is a problem that has persisted for weeks, whatever. If I'm dealing with something, depending on what the injury is, for longer than 2 weeks, I'm saying, okay, well, it's time to make an appointment with your family physician. And that's the way that I had done these things. So in our questionnaires, when they ask about how are you using, when they first, I know we've only taken 2, but when they ask, how did you utilize your supervisor this week? Or have you reached out to your mentor? The first time I got that, I was like, I didn't ever feel like I was lacking something. I felt like that would feel like just another thing that I have to follow up with. I was, I think, approaching it the wrong way. And now this last week particularly, schoolwork was really hard. I don't know about you guys, but it was really hard for me to keep up with all of the things that we had to do. On top of it, the patient load, and I know that we can all sit around and complain about time and stuff, so I don't mean to like take your time whining, but basically all of these confounding things that are, super important, I was trying to find a good balance with, and things just weren't working out, one thing after another, things I weren't expecting. I really identified like how awesome it would be to have another healthcare professional that I could just be like, man, I have all of these people that I don't know what I'm doing with those. Someone to vent, not really vent to, but to help relieve some of those stressors. It was probably the first time that I was like, damn, I wish I had a mentor right now. They could just, not another pat on the butt or anything like that. That's always great to have, and someone to vent to, but really someone that could identify medically, okay, here's how I would treat these situations so that it's not absorbing all of this time. And then I can figure out my balancing if I just had that support, I guess. So I'm curious how your guys' mentorship is going. What are you utilizing your mentors for? Are you utilizing your mentors?
Well, who else here really has somebody like Jody? It sounds like your situation is very similar to everybody else's here, except for maybe Sydney, in that who who are like who are the mentors, because we're all kind of working independently.
Yeah.
I'm not. I work in a clinic, so I have a lot of doctors. So does Megan. But for Olivia and Nicole,
Yeah, so my mentor works with me. I see him every single day. So that's, I think, I'm kind of lucky in that situation because he is there all the time, and he worked with Navy, their football team, and their wrestling team, like he likes to say. So he's worked with athletic trainers, and he's been at this clinic now for like the last 8 years. So he utilizes and understands what we do. So he's a really great advocate when the patients see him and then they get transferred to us. So, and he's super receptive. And then we also have PA students that come in like during the month, and I get to kind of listen in on their conversations, which is a lot more medical and not so much musculoskeletal. It's a mixture of both. So, and I just love his way that he teaches. I can go to him and ask him anything, or if I'm uncomfortable about the mental health thing, I'm like, hey doc, like, I know this is something that you guys don't really do, but like, this is what's happening to me. He's like, no, I'm glad that you brought that up. Like, sometimes it's a difficult situation. So I'm just lucky because he's there every day. So I can reach out to him if I'm about something, or someone's not getting better when you get by, or did we ever get an x-ray on this person, whatever the situation is. So mine, I think, is a little bit different.
So for me, that has been like kind of what I started off with. That's been my biggest obstacle so far in this new job, because in the collegiate setting, you kind of have it set up where you're with a staff, so you have, our team physician was in our facility 2 days a week. He was 10 minutes down the road, and we could walk in they had a walk-in clinic, so we could walk in with our patients. So this was the first time where I feel like I'm out on an island, because I'm out at the school, but I am in clinic 2 mornings a week. And for the first couple of months, I'm shadowing another athletic trainer, and then eventually we'll go on opposite days in the clinic seeing patients. So that has been really helpful. However, it's helped me notice things that I don't want to do. He's been there for like 15 years, and so he's very set in his ways. And so some of the things like that we've talked about in classes, and some of the overall change that I'm trying to, or progress that I'm trying to make in my practice, he flat out will say, don't do that. And I've been around long enough that I'm like, no, I'm going to do this anyway. And I don't work with him every day, so it's fine. But I just have to go, oh, okay, and I just like, yeah, I'm going to go do what I need to do at my school anyway, because you're not going to be there. But it has been like a huge task to figure out, like, okay, who needs, like, I have a kid that needs knee surgery. Who's the knee doctor? How do I get in touch with the knee doctor? Like, just very basic things that aren't covered when you start a new job. And it's just a matter of like texting and annoying people, feeling like you're annoying people until somebody who's been around gives you the right answer. But I have been lucky. I'm very fortunate that I have really close relationships with mentors outside of my place of employment. So as far as me as a professional and what I'm doing clinically, I feel like I have a lot of outside support for that from athletic training colleagues. But navigating the job and getting the patients the care that they need has been a big obstacle, because I don't feel like I have strong mentorship from my supervisor. I feel like my supervisor is my supervisor. He's not a mentor to me yet. I mean, I think that may develop, but it just doesn't seem like that's in his personality. Like, that's not something he, kind of like when, I don't know if you guys talked in your mentor versus role model, but like, you have to want to be a mentor, something that my group talked about. Like, it has to be something that both parties want. And I don't think this person wants to be a mentor. Like, I think he just wants to come in and do his job and go home. Yeah. So, which is fine. I mean, there's nothing in his contract that says he has to be a mentor, but he definitely is a supervisor. But I'm glad that I recognized that early, because now my expectations aren't lowered, but I just changed them, right? Like I know what to expect from that relationship now. And so if I need mentorship in an area, like I've been working on seeking that out from other individuals, because I had to change the expectation for the relationship with my supervisor pretty early on, once I realized what that was going to look like.
Yeah.
Has anybody here used the mentorship panel?
Oh.
Who
Does
is that?
anybody know like what it is or who's on it or how we access it?
I feel like we've talked about it in our like group chat at one point, but that was a long time ago.
I think, and I know that it's, or what rings a bell is I remember like Bradley, Jackson, Zach. I feel like they mentioned something about being a mentor, or maybe it was they were just being friendly. Maybe I'm thinking that they just said, if you ever need help, reach out. Don't feel like you can't talk to us, but I don't
So,
know like official panel that I'm aware of.
so do you remember Diane Sartanowicz? She came and talked to us. She was the D1 director.
Yes.
Yeah.
She's on the mentorship panel, and there's a lot of people on it, and I've seen it somewhere. I just don't know where it is. Like I've looked for it on the website, and maybe it's in one of Dr. E's class forums, but I think that would be really useful for everybody here, because like Olivia, you don't have a great relationship with your supervisor, and you have, it sounds like you have a really good network of a social circle of other athletic trainers, but people that are deemed kind of worthy by the DAT program might be a good contact for everybody here. I don't know.
I agree. And I've kind of I've posed the same questions to myself that you just did, Dan. Like, okay, I didn't know it existed until we met her during DAT weekend. And they talked about the faculty were talking about the mentorship panel, like it was this thing that just was common knowledge. And I don't know about you guys, but I was sitting in the back of the room going, okay, this is a thing. Wait, what? Why did I not know about this? Did I miss something? Did somebody else like not tell me? Like I was just like clueless about it. And I do know that there are some really awesome people on the list, because they were name dropping them during the weekend, but I haven't heard or seen anything about it since then, other than the question on our survey. And the last 2 weeks, or the 2 times I just put, I have no idea how this works or how to get started. Like that's all I put, because I was like, I would love to do this, but I don't know how this works or how to start it.
Yeah.
I can definitely send an email to Dr. Games, because I feel like everyone's kind of in this like spinning circle and we don't really know. And I feel like, Dr. Games, he's kind of like, we'll just ask. He doesn't know if we don't know. So I can shoot an email on behalf of us and just be like, hey, where is this contact list?
This is probably entirely superstitious, but I almost feel like all 3 of them are just waiting for us to be like, hey.
Yeah, probably.
They're like, hey, it's week 5. Why haven't they asked yet?
There's not actually a panel. They're just like, have you
Yeah.
used it? And we're like, yeah, totally.
I kind of forgot about that question until I got back to it. I was like, I still don't know who.
Yeah.
I still haven't used that. What?
So, well, then they ask you why. And last week I said, I didn't know really that there was one that we reach out to. And this week I started analyzing, what I would reach out to them for, I guess, because I haven't respectfully used a mentor before. So I didn't really know, besides venting. And I feel like I get a lot of that off my chest with, whoever will listen. So.
And there's a big difference too between like a positive mentorship relationship and just venting. Like you can vent as a mentor, but a lot of like one of my main mentors, like she doesn't let me vent. Like she'll say, what's the problem that you need to solve? And then she'll go about like trying to, cause like I'll start to vent and she'll stop me and she'll go, what's the problem you need to solve? And then it's all action based. because she knows that that works best for me. But like, she keeps me from venting because she knows that I've probably already vented about the same thing to 3 other people. And that's not what my time with her is for,
Right.
you know?
And I guess I just don't really have problems like that I'm stuck in, that I don't know the solution to. Usually my barriers are the I don't want to say the time. My barriers are the motivation to keep at the same problems to fix them.
Yeah, I think for me, I had a really tough time with my supervisor at the clinic. She's an athletic trainer, so like I thought that like she was gonna be like advocating for me, but like almost every time I bring something to her about school, especially, she kind of like rolls her eyes at it. And I just had like a one-on-one meeting with her. She met with everybody in the clinic, but I had one, and I'm still relatively new, but I was the first hire of like 6 new people. So I got kind of like, I was the only one who got hired at that time. And then a couple of them came 2 weeks after me, and then like a couple like 4 weeks. So I just kind of like got thrown into the pack of wolves and said, here you go, good luck. And so I've been like working my butt off, and this is not a setting that I'm used to, and not a setting that an athletic trainer typically works in. And she basically told me that she's been approached by people that have told her that I avoid work and that I'm lazy and that I don't work hard, which is like the complete opposite of my mindset. And like we're so crazy busy all the time in our clinic, and so like we are just have to go. And I was like, I think one of the reasons that like I do that is because I stop and think about like where I'm going and like need to process what I'm doing before I do it. And she goes, well, that's your problem. You overthink everything, and you just need to stop thinking and just do things. And I was like, what? Like, I'm trying to like do things the right way. It's patient care. And like, in all honesty, if I messed up, their insurance could be affected, or like their care could be affected and stuff. And I'm like, I'm just trying to do the right thing. And just because I stand there and like, she's like, well, you need to like, if you're doing something else or waiting for something, go room a patient real quick and tell someone else to listen or wait for that thing. And I'm like, I don't know how to prioritize things. I still don't know how, like, what needs to be prioritized even. And so she just basically was like, well, you just need to stop thinking so much.
Yeah, that doesn't.
It's and ever since that meeting, every time I walk into that clinic, I am like overwhelmed with the feeling of everyone thinks I'm not doing a good job. And so I'm like, and then when she comes up and asks like during the day, like, oh, how's it going? Literally every time I'm like, it's fine. Like, I'm not fine, but and it's just like this constant like fear of what everyone else is thinking, because it's been such a bad thing that they've literally approached my supervisor about it. And so it's like I don't feel comfortable bringing issues to her now. I feel really like isolated. And so yeah, so like having an outside source of that, I think for me would be really beneficial, because I kind of lost that support system, it feels like to me, and I don't know how to like bring that back up or like approach it now, because like it just a lot of people just think I'm lazy, apparently. So it's been challenging. And so yeah, I think having a panel of people that would advocate for me and really like advocate for me being an athletic trainer, I think would be for like really helpful for me personally and professionally.
Mm-hmm.
So Nicole, similar to what you have with the weekly meetings, we also have that, and it's traditionally it's set up for the physician residents, and they do presentations on their research or whatever research they're partnering with the attendings on and things like that. And it's open to anyone in sports health, which is like ATs, PTs, physicians, residents, fellows, but it's traditionally just the attendings and their residents. And my supervisor goes every week, and they're at 6:30 in the morning on Fridays, which is really rough. But I've gone twice, and when I'm introduced to other physicians, like 3 of the physicians that I've met so far have all said, oh, I remember seeing you at clinic meeting. And I was like, oh yeah, I was there. And so I've noticed that it's a really good way just to connect with the physicians and build that network, and that I'm trying to create, not necessarily for myself, but like to get my referrals out there for patient care quality. So that's one thing that I hate setting that 5:30 alarm on Thursday nights, but it's already paying off. And so it's something that I kind of look forward to now, because I know that it's gonna like benefit not only me, but the patients that I'm interacting with.
Yeah.
So that when you mentioned that, I was like, yeah, me too. But the other thing I really want to gain is more confidence in dealing with parents. So this whole parent world is brand new to me. And especially because I'm not a parent, I'm treading very lightly and navigating that whole space. Yeah, it's a challenge for me, because I'm used to just communicating with the patient and not having to worry about the patient's parents. So, there have been some hiccups along the way, but that's one thing that I have reached out to mentors about, like, okay, what do I do with this? Like, how do I deal with this parent text message, or how do I deal with this parent who just went off on me about something or whatever? That's a big thing that I want to work on this semester.
So that's what I was going to talk about, was something that I think is going to help. There's a couple things that I wanted to focus on with my clinical experiences. I wanted to get better at parent communication, just because I know that I need to be better liability wise. I need to be better about communicating with parents and educating parents. So I wanted to be that. And the other thing that would really make me feel like a clinical expert is if coaches came to me with some patterns or improvements that they want to see in their program, and they utilized my knowledge to facilitate those conversations, or created I don't know, like not a seminar, but something along those lines. And about the time that I had even thought about, like, okay, I'm going to try and pitch this to my coaches, they were like, hey, I'm seeing this problem and I would really like to have this discussion with you. I was like, you took away my discussion with you. That was my idea. Anyway, but so I feel like, I don't know, in some small sense, I almost feel like there was a win, or like an I made it moment. I feel like I'm becoming the clinician that I wanted to be. I wanted to be utilized and not avoided. And I wanted to be respected and, or not respected. I want to be respected, but I guess valued. I wanted to be valued instead of always having to promote my own value. That makes me feel not valuable when I have to tell people how valuable I am. Yeah. And so I feel like I made it. But going back to those conversations with parents, so I have increased my communication, and it's now come down to that if I'm not communicating within like a certain time limit of seeing that patient, they're on I use Healthy Roster, and it has a communication platform in there. They're on my Healthy Roster saying like, hey, haven't heard from you in, an hour, 5 minutes, and I'm like, it's kind of giving me more, I feel like I made a gain, but now I'm able to be criticized almost in a different way. I'm like, God, can I just get on top of one thing and be like, yes, I'm doing so great, nope. But I'm happy to have the problem, I guess. I'm happy that they're complaining about that instead of absence of communication. And, these are happy complaints.
I think I was gonna say one other thing just for me would be because everyone works with different providers, there's so much miscommunication with care. So like today I had a patient and she's got some plantar fasciitis and she's taking some naproxen or naproxen, and she's like, well, it makes me really sleepy. And I'm like, naproxen? Like, okay, well, let me go talk to doc and find out if that's real. Well, then lo and behold, I found out that she's taking Flexerol for her back. And so she was taking Flexerol, which, if you guys know, is a muscle relaxer. So she was falling asleep at work. And I'm like, well, you're taking Flexerol too, and you're having back issues? Like, and there's just always this miscommunication. She got sent over for me for like an ankle stabilizer support. And I'm like, you don't need that. And why are they, and now they're ordering it. Like, it was just sometimes just a miscommunication, but I don't know if that will ever 100% be as great as I want it to be. I think that's just also the setting that I'm in, that because providers switch around so frequently, and at the end of the day, the ship's medical has overall ownership of the sailor, so what they say goes. Kind of like the parents. They're like the parents. If I, obviously if signs of life are diminishing, then what I say goes, but overall they say goes. So that's kind of difficult too. It's communicating with.
What a great way to reiterate how important it is to gain patient history. Like, I mean, you're really held to that. For at least in my setting, I can have I could probably get away with not asking the same questions over and over again. But with you, you're right, they might get something totally different from day to day, things you didn't have before. And yeah.
I had a patient that I thought had a calf strain, but it was a blood clot. That was a missed call.
Okay.
That was a bad one, but it's okay. But it was one of those where I'm like, how old are you? Oh, 46, you're on birth control, like ding ding, and just that didn't go into too much of a depth of a conversation.
Yeah.
So yeah, like little things, like a lot of medical jargon that you just don't think of, where I'm like, I need a more systematic approach because I missed that one.
Yeah.
Yeah.
That's all I got, guys.
I think for me, like, I don't always enjoy my setting, so it gets challenging because sometimes I just want to go into work and just fly under the radar and quote unquote do my job and go home because I get frustrated, and I feel isolated. But one thing I've really been trying to do is like every little detail of patient care that I could possibly include, I try to. So like, for example, the other day when I was covering some volleyball for one of the high school athletic trainers, and so I was just there all night because I was covering all 3 levels of it. And I had one of the patients come in. She was on the JV team, and she came in and she was talking to me a little bit and chatting with me, and then she goes, so can I like talk to you about my head? And I was like, yes, you can. She goes, I got hit with a ball last night in my head, and it's just really it's really hard for me. I'm having a lot of headaches, and like I had a concussion 3 years ago that took me out for 8 months, and I'm really nervous. And I was like, okay, yeah, let's do this. And I the whole time I was doing the evaluation, I was like, how do you feel about it? And like, is it okay with you? Like, if we, like, this is why I think we should hold you out, but like, do you want to get back to playing quickly? Do you want to do this? And like, really tried to ask her what she wanted, and like, okay, I'll relay that to your athletic trainer and see what we can do. And like, I was like, clearly you're a little nervous about it, but you also want to play, so we're gonna like work on that. And like introducing myself as an athletic trainer and asking what the patient wants. And one of the things when we were doing like the disablement model of like including friends and family into their care, so we take a lot of our patients to x-ray, and there's like a little waiting room. So we have x-ray right there in our clinic, but there's like you take them out of the room and bring them down to x-ray waiting room, and then they bring them back when they're done. And if there's ever a like family member in there, I always offer, hey, would you like to come with us and walk down the hallway with us, or would you rather stay here? And so it's just like, I might not be able to do these big grand things, but every time that I make my patient the center of what I'm doing, I'm growing as a clinician and I'm getting better, and it's becoming a habit. And it's something that like I've always said I value my patients, and now I'm like learning how to incorporate the little interactions with them, and really advocating for what they want. And if they say, hey, I like, for another example, I had a mom bring her 6-year-old in the other day, and the mom was like, we've been to 4 other doctors and nobody has ordered any imaging for anything. And so I'd really like that. And so I went out and I talked to the doctor and I said, hey, this is what they said. The mom would really like some imaging. Is it okay with you if we start with imaging? Oh yeah, absolutely. Let's go get some imaging. And so just like little things for me. I really want to grow in the little things because they really relate to big things. And they build patient trust, and they just make me a better clinician. And so instead of getting discouraged about not being in the ideal setting or ideal world, like I'm still able to grow and learn as a clinician and as a person individually.
Yeah, I think that goes back to, Indiana State's DAT motto kind of is leaders can lead within any setting. So you don't have to be at the college setting, you don't have to be at the professional setting, you don't have to be at the high school setting. Like that's why you're in this program, and they obviously saw that, and you're showing that. So I think remember that, and don't lose sight of that, because I think they believed in you. So that's your why. They knew your why probably already before you knew it.
Yeah.
So just remember that, because you don't have to be in a specific setting to be a leader.
Yeah, and I think that's like what I'm growing in the most, because like instead of getting frustrated, I can take those little moments and run with them. And eventually, like, I'm just gonna keep getting better and better with every interaction that I have. I'm gonna grow from it and so like changing my mindset to saying, how can I learn from this, and what can I learn from this, and move forward from there, versus just, like I said, like flying under the radar and just like I can be a lead, like you said, I can be a leader in whatever setting as long as I want to be and actually am aware, like go in with that mindset and that attitude towards it.
We probably should wrap this up in like 3 minutes. Just giving you guys to stick around his time. Does anyone else have anything that they want to gain from their clinical experience specifically? Did everyone speak? Is there anything pressing that we want to add?
I don't think so.
Okay. I know he said that he didn't want us to go in a circle, but I really like that we can reflect on those things and talk about mentorship and talk about what we want to gain from the clinical experience. I guess I just wanted to end this video talking about how I think I focus a lot. It was hard for me to answer that last question because I focus a lot on what I want to give my clinical experience. Like, what do I want to give to my clinical setting? And it's so much about me, and it really is about like what you build your setting to expect of you. And that's something that I think I'm altering what I'm doing. So I recognizing that I don't have a physician that's really involved in my clinical setting made me realize that I would like other people holding me accountable for things, other people to expect certain things from me, like coach communication, parent communication, and creating goals not only with the patient but bringing in friends and family and stuff. So it really is like whatever it is you're trying to gain from your clinical experience, it's got to be some sort of energy that you put into it that's able to bounce back for you, I guess. So I just thought that was an interesting way to phrase that question. Okay, so that's it. I know it's midnight. Thank you guys for, well, actually, no, it's not midnight for you. It's now 1.
Midnight for me, so that's one of us.
Thanks, guys, for working with my crazy, I know I was absent and all that stuff, but I appreciate your time.
Thank you. I'll send you guys pictures.
Please do. Congratulations.
Congratulations. Good luck with everything. Bye, everybody.
Bye.
Guys.